Vicki. How are you today?
Good.
And when you first came to our office, you had some cavity problems, is that correct?
Yes, it is.
And you came to the office because you really were considering alternative treatments to the drill. Is that correct?
Yes.
And why is that?
I don't like the way the drill feels on your mouth, even if you have Novocaine. The injections are uncomfortable. The numbness after was uncomfortable, and the sound of the drill is terrifying, and you can feel it vibrating.
That sounds scary to you.
Mm-hmm.
What also caused you a bit of dental anxiety was if we used the drill, we would have had to give you Novocaine injections. Is that correct?
Yes.
What's wrong with Novocaine injections? Do you have fear of those?
Yeah.
So, we did some fillings on your teeth with a laser.
Mm-hmm.
And when you compare that with the dental drill, which one did you like better?
The laser, most definitely.
Didn't make any noise that offended you?
No noise, no vibration. Well, there's noise, but it's not like the drill. You don't hear a whirring sound. It's a lot more comfortable. No weird vibrations, and you actually don't even really need the Novocaine.
So all in all, the laser fulfilled what you wanted to get out of your dental experience?
Yes.
Is that correct?
Yes.
Yes. And would you recommend this procedure to others who are suffering from the same sort of fears that you are?
I most definitely would. The laser is quieter. You don't need the Novocaine. You don't have that pressure or vibration on your jaw, and it's definitely a lot less scary.
In your opinion, that's the way to go.
Yes.
Thank you very much, Vicki.